Dr. Derek here. Testicular lumps and swelling. Let's dive straight into it. You can basically split all the causes into two groups, those that cause pain and those that usually don't. Let's start off with some of those that can cause pain by looking firstly at testicular torsion. Now, this condition results in a really painful testicle. You see, most of the time the causes of it are unknown, but it can be triggered by intense exercise or injury to that area. Testicular torsion is a surgical emergency. This means that if it occurs, doctors need to act fast and you will need an operation to save the testicle. In this condition, the spermatic cord gets twisted. So you can imagine that when this occurs, the affected testicle is located a lot higher than where it usually is. This pain can be so severe and can sometimes also be associated with pain in the stomach, nausea, and vomiting. Testicular torsion tends to occur mostly in younger patients between the ages of 13 to 16. And as mentioned before, the reason why surgery is so urgent is because when the spermatic cord gets twisted, blood flow to the testicle itself can be limited, meaning that over time, the cells of the testicle will die if we don't act fast. Next up in our list of painful causes of testicular lumps and swelling is a condition known as epididymitis. If you take a look at this picture here, this area right around here is what we call the epididymis. You see, when the epididymis gets inflamed, this can lead to all of the pain that we see. And if you have this condition, you may present with symptoms of an infection such as pain on passing urine, a discharge from the penis, and also going to the toilet more frequently for a week. Between the ages of 14 and 35, the most common cause of this condition are our STIs. And over the age of 35, or in those with a low risk of STIs, the most common causes of this condition include E. coli. E. coli is a bacteria that can spread from the bladder to the epididymis and cause all of that inflammation. So let's take a look at another group of testicular disorders. These don't typically cause pain. Starting off with a condition known as a varicocele. Varicoceles are an enlargement of the veins within that loose bag of skin that holds the testicles. We call this the scrotum. A lot of patients who have this condition describe it as something like feeling like a bag of worms. The swelling tends to get worse on standing or straining, and it may disappear on lying down. This condition is usually managed conservatively as it usually doesn't cause any issues. Now, an interesting fact here is that 90% of varicoceles occur on the left-hand side. Next up in our list of painless testicular conditions, let's take a look at a condition known as a hydrocele. This is a type of scrotal swelling that occurs when fluid collects in the thin sheath that surrounds the testicle. Most develop for no reasons at all. They are harmless and can be left alone, as they're usually only very small. Now, sometimes if they do get larger, then a procedure may be required. Hydroceles feel smooth and are usually located in the front of the testicle and not within the body of the testicle. We've taken a look at some causes of testicular lumps and swelling in today's video. Now, the most important thing is to regularly examine yourself at least once a week so you know what is normal for you. If you do find a lump or anything you are not sure of, it is so important to see your health provider, so this can be looked into further for you in order to rule out other testicular disorders such as testicular cancer, which we haven't covered in this video, but we do cover it in one of our other videos, so make sure you check it out. As always, please leave a like and subscribe if you found today's video helpful, and remember, I truly care about your health and I wish you the very best.